Our guest is Dr. Paul Farmer, UN Deputy Special Envoy for Haiti under Bill Clinton. His new book, Haiti After the Earthquake. He's a university professor at Harvard University, a medical anthropologist and physician, co-founder of Partners in Health, which operates in a number of countries around the world, but began in Haiti. Now, I saw Arcade Fire at your 50th birthday, Paul.
It's pretty cool, huh?
They are raising money for Partners in Health around the world?
They are. Yes, they are. In fact, for every European concert, €1 went to Partners in Health, and in their American concerts, $1. And they're very active, not just raising money through their work, but they've been terrific spokespeople. Obviously, you mentioned my 50th birthday. They're a connection to a much younger group of supporters of health and social justice work, particularly Haiti. And we've met a lot of people in Canada through Arcade Fire as well. They're terrific people. Talk
about how you founded Partners in Health, and even give us a brief history of your own life. Tracy Kidder, of course, talks about it in this remarkable book. Talk about how you came to do what you do. Well, you didn't exactly grow up in a traditional, conventional way.
I didn't. I see you're going to push me back into my childhood. I came from a large family, and I lived mostly in Florida. I think you're probably referring to the fact that for about 10 years prior to going to Haiti, I lived with my brothers and sisters and my parents in a bus that had been Tracy Kidder made a big deal of this, that had been a tuberculosis bus. Now, of course, that had nothing to do with the fact that I became a tuberculosis specialist, I don't believe, but it is kind of funny looking back. These were these buses that moved around American cities to do what's called active case finding, to take x-rays of people. And my father figured, well, there's 8 of us. He was a school teacher. If we bought this bus, we could go on vacation together, and so we ended up living in it. He was a pretty interesting guy. I had heard about Haiti growing up in Florida, and then I went to college and started studying about Haiti in a class, and then thought maybe I'd like to go there, and I knew I wanted to be a doctor. And so after college, I do tell students, though, that there's so much serendipity in this. You can never plan these sort of things out. Have to be open to experience. I also thought I wanted to go to Africa, and it would be many years before I did go there to work as a physician. But Haiti I went to right after college, and I ended up in central Haiti in a squatter settlement. And I didn't even know it was a squatter settlement, but it was created by a hydroelectric dam that had flooded this valley. So I learned about development work from disgruntled Haitians, and that was, in fact, probably a good way to learn about development work. And I learned a lot about health and social justice, that is, the right to health care, and why that was such an important concept for people living in poverty, especially people who, like many of those I lived with, felt wronged by immediate and remote history. So Haiti's really been my greatest teacher. I went to medical school after my first year in Haiti.
And then Partners in Health?
Partners in Health was, thank you, Partners in Health was born for me and for some of the people I met in 1983 out of this desire to be able to provide medical care for people living in great poverty. And I would add that of the people who started that organization almost 30 years ago, everyone who is still alive is still working on this project. The Haitians, Ophelia Dahl, who I met that year, she's the director of Partners in Health, and we're still together.
And the model of Partners in Health?
The model was community-based care, and is community-based care. One thing that bothers me now is the idea that community-based care means that we don't need excellent hospitals. It doesn't mean that at all. It means that you're going to reach all the way from people's homes to so-called tertiary high-tech medical centers, and that's what we started building from the ground up in Haiti in 1983. That required building clinics and hospitals, but also training community health workers, and that's really what we're doing in Africa as well.
Can you talk about cholera? You have Haiti hit by this horrendous earthquake, and then you have the cholera epidemic. Talk about how cholera came to Haiti.
Well, I think cholera is a marker of how work like Partners in Health work is not enough. Because I don't know how we could work any harder. And we've, as I said, built hospitals and clinics and trained thousands of community health workers. But that's not the same thing as building municipal water supplies and having a strong public sector that is able to provide these basic services. So cholera was really a disaster waiting to happen for many, many years. I was on your show, I think, some years ago talking about the embargo of development assistance to Haiti, which was never a declared embargo. To me, it was the 34th time the Western world, in whatever incarnation, had blocked assistance to Haiti. That's by the Haitian accounting. But why I brought that up then was that I knew, and we all knew, those of us working with Partners in Health and its sister organization, which is called Zami La Santé, which means Partners in Health in Creole, we knew that we were not able to replace a public water system, and we wanted to see those things built, just like we wanted to see public roads and public education. And so when assistance like that was blocked to Haiti, we said, if we, these are institutions, they're development banks, multilateral organizations, and certain countries that were unhappy with Haiti's political choices. If we keep blocking assistance on issues like water, primary education, primary health, we're going to see outbreaks of waterborne disease and see epidemics of diseases like cholera. So there's nothing really scientific about predicting this. And then cholera, as you know, is the constant companion of war and natural disaster and displacement. So we were really living in fear that cholera was going to come along for many years.
Now, you were one of the first people. You were quoted by AP saying that the cholera after the earthquake was brought in by the Nepalese peacekeeping force, the UN force. How did that happen?
How did it happen that I was rash enough to say that? Well, of course, it was completely unwitting. I mean, no one ever intends to bring a disease into a population that had been free of it. And I, in a way, wish I hadn't even gotten involved in the discussion. In a way, I thought it was important at the outset of the epidemic to figure out where the strain came from and to do some basic investigation of the genotype of the strain, and not to get into too much jargon, but how do we know what antibiotics, for example, would be useful in treating it. You really need to do basic study of the organism. Plus, at that point, in late October of last year, it was still conceivable, at least, that you could limit cholera to a certain place and not have it spread across the country like wildfire. So that was the intention back then, not to point fingers at the hapless, peacekeeping troops that unwittingly brought this disease into Haiti. Also, having studied Haitian responses to epidemic diseases in the past, like AIDS, I felt I knew what was coming in terms of what many of the people living in central Haiti would say about this.